A very warm good afternoon to all. So I would be just touching on the topic of microbial dysbiosis and limbal stem cell deficiency. We all know that limbal stem cell deficiency occurs due to a direct damage or destruction of the niche environment, and it is marked by neovascularization, loss of corneal epithelium and stroma, and the cornea eventually becomes opaque. So coming on to human ocular microbiome, it is unique because it is unlike the gut microbiome and the skin microbiome. It is exposed to the environment, and it is paucibacterial in nature. The three main phyla which are recovered from the ocular surface are Propionibacterium acnes, Corynebacterium, Staph epidermis. Some viruses and fungi also make up the human ocular microbiome. So in limbal stem cell deficiency, you do have two components, a microbial dysbiosis which happens, and also an inflammatory microenvironment which propagates the disease of limbal stem cell deficiency. So to understand the imbalance in the microbial composition and its diversity, which may be hallmarks of limbal stem cell deficiency, which may lead to poor wound healing and epithelial cell dysfunction, we undertook a study where we evaluated profiles of ocular surface microbiomes in patients with limbal stem cell deficiency and compared them to healthy controls. So the sample taken was from the inferior conjunctival fornix. DNA was isolated. 16S ribosomal RNA PCR was done, and then these were sequenced to understand the microbial population by bioinformatic analysis. So it's just the study that was conducted to understand, because it's a novel topic. So what we had, this patient profile were usually patients of chemical injury or Stevens-Johnson syndrome. And when we compared the rarefaction analysis, which gives us this Shannon and the Simpson index, basically it gives us the richness, the amount of bacterial load in the conjunctival flora, and the diversity. So the species richness which we saw in patients of limbal stem cell deficiency was much higher than the control group, and also the diversity was also more. So there were more genera and phyla isolated from patients of limbal stem cell deficiency than we saw in the controls. And when we looked at these are the heat maps that are generated from the microbial flora. So there was a clear and significant difference in the bacterial species composition. The healthy ocular surface is characterized by a low diversity community with few dominant species. In contrast, in limbal stem cell deficiency, you have a marked dysbiosis, meaning there's an increase in the diversity and emergence of new different bacterial profiles. So in the patients that we study, we found a high abundance of species like Fusobacterium, Corynebacterium matrixotae, and which are associated with inflammatory processes elsewhere in the body. And there was a reduction in the core microbiome or the normal commensal community that is present. So that is the reason for disruption of the ocular homeostasis in these patients. So these patterns were then seen in these patients. There's a alteration in the diversity and a shift in microbial abundance in these patients. Because of the microbial imbalance thus created, there is a reduced abundance of beneficial commensal bacteria, which may contribute and increase in the pathogenic taxa, which may contribute to the ocular surface inflammation seen in limbal stem cell deficiency. So the future holds promise for this, because you may have some microbial biomarkers to detect and to treat microbiome targeted therapies for limbal stem cell deficiency. It may help in patient education and awareness on how his disease is progressing or what therapies are having an effect on the microbiome. And research on microbiome-based diagnostics and therapies holds significant promise for enhancing patient outcomes and quality of life. Thank you. Yeah. Depends on the stage of the limbal stem cell deficiency. In mild limbal deficiency, you do not need, but suppose you're giving steroids to a patient with limbal stem cell deficiency, you definitely should add a prophylactic antibiotic.
No, but the introduction of antibiotics per se, like would it not destroy the normal microflora of the ocular surface?
So in mild, we do not need to give, but in severe cases or moderate to severe cases, where you are anyways giving steroid, you are disrupting the microbial flora. So there it may be needed. So a targeted approach may be better, and a customized approach may be better for the patient-to-patient variation.
And before any kind of surgical intervention for the ocular surface disease, like you're doing an suppose a limbal
Definitely. So prophylactic antibiotic for all such cases who are undergoing surgical intervention should be given.
No, but do you do sort of like conjunctival swab culture before proceeding with the surgery?
Yes,
So
bilateral blind patient with Steven-Johnson syndrome, which suppose we're doing a comet or any other transplantation, we should do a conjunctival